Hi, we are Group 1, and this is Scenario 1 regarding patient safety. Throughout the simulation, the objectives are that the students will identify threats related to patient safety, remove or lessen the threat to the patient, and implement patient safety strategies. Throughout the scenario, we'll meet 3 different characters. The first is going to be Mr. Smith. He's a patient. He's 1 day post-op from a bowel resection. Then his nurse is Sanura. She is a new grad nurse working on night shift. The second student is going to be charge nurse Victoria. She will be facilitating the conversation between the doctor and the nursing staff. And then the third student is going to be Dr. Jones, and he is the unpleasant doctor who we are waking up during night shift.
How's it going?
Hey, good. How are you?
Pretty good, pretty good. Long shift?
Yeah, long shift, long day. But this one shouldn't give you too much trouble. It's
Okay.
been pretty good for us.
Good to know.
Hey, Mr. Smith, how are you?
I'm good.
Good.
Kind of thirsty.
Okay.
Also really dizzy and lightheaded.
Okay. I can bring you in some water, and I can bring in your nausea medication for you when I come back in to do my assessment.
And this is Sanura. She's going to be your nurse. I'm going to go home. I get to go home finally. So it's been a pleasure taking care of you. I'm just going to tell her a little bit about you and told her you wouldn't be too much trouble for her, okay?
Okay.
All right, so this is Mr. Smith. He's a 43-year-old male.
Okay.
Admitted on 10/17. He's 1 day post-op following bowel resection. No known drug allergies. He has a history of hypertension, anxiety, and stress ulcers.
Okay.
He's alert and oriented ×4. His respirations have been 96% on room air,
Okay.
and there are orders for oxygen 2 liters if he stats below 90%. He has an IV 20 gauge in his right hand, flushes and draws well. Saline locked right now with no fluids. Vital signs have been pretty stable. He's a little hypertensive, 140/90, but you know that kind of is consistent with his history.
Yeah.
Heart rate slightly tachycardic, about 110s.
Okay.
His respirations have been between 18 and 20.
Okay.
So, you know, for me, no edema. His incision site looks good.
Okay.
I'll show you in a second. Labs, as far as labs, we got an H&H earlier. We're just waiting on results.
Okay.
And I can actually call lab for you before I leave. And,
Okay. All right,
I know
that
you
sounds
got
good.
a few other people to see.
So we're on fall precautions?
Fall precautions.
The band is on and everything?
Post-op, no allergies.
Yeah. Pain's well controlled?
Pain's been well controlled.
Okay.
He just got nausea medicine about 3 hours ago.
So we're about due for it. I'll bring it.
About due. He tolerates it pretty well. Like I said, he's been pretty easy. He's on continuous pulse ox.
Yeah.
And continuous blood pressure checks, so it should make it a little easier on you too.
Okay.
Mr. Smith, do you mind if I show Sanura your incision site?
Oh, that'll be all right.
All right, so if you look right here, you can tell he's got a little red, but again, 1 day, no edema. His toes have been good, no swelling.
Okay.
It's been great.
All right. Well, I'll be back in with your meds and the water for you, and we'll get you all sorted out. Yeah. Okay. So I've got your medications here. How are you feeling
Oh,
right
I
now?
don't feel so good.
Okay, what's going on?
I need to throw up.
Okay, I'm going to sit you
Oh,
up here.
hurry.
Okay. And then you sit the head of your bed up.
Do you have a basin?
We're going to split you here. Yes.
Oh, thank you.
Right now. I'm going to call my charge nurse. Okay. Hey, Victoria, can I get some help in here? My patient is vomiting.
What's going on?
Great. Well, I've noticed we've got some blood in our vomit here. We're splinting his incision. His vitals are very kind of inconsistent right now with what they were. I came in to give him his meds and some fluids. So he's been extremely thirsty and was talking about some mental confusion, some lightheadedness, and it's been getting progressively worse since I've been in here. So I don't want to leave my patient's side, so would you mind calling the physician for me? Do you know who's on shift right now?
Should be Mr.
Jones.
Johns.
Oh, Okay, well, yeah. Can you give him a call?
Sure will.
Okay,
So you
thank
go ahead
you.
and monitor him. Also make sure
I will.
the IV site is pink just in case if the
I will.
doctor requires anything.
Will do.
Okay, I'll be
Will
right
do.
back.
Ring, ring, ring.
This is Dr. Jones. I really hope this is important.
Hi, Dr. Jones. This is Victoria on 3E's calling about Mr. Smith in room 10. He was admitted at 10:17 with a bowel resection, increased thirst, dizziness, and nausea in the past 30 minutes. Patient also began to vomit with blood. His initial vitals were within normal limits. His blood pressure was 140/90, but now at 72/50. His heart rate was 72 and now at 145. And respirations were at 18, now at 35. Breath sounds are clear. His hemoglobin reading was at 8 and hematocrit at 21.
So what have you guys done?
We've raised the head of the bed, we've given him his PRN Zofran and assisted with splinting the incision. I recommend that you come in and see him because he's rapidly declining, please.
Okay, well, I really hate being woken up, but go ahead and get an H&H, CBC, and a BMP, and I'll be on the way.
Okay, thank you. So that's an H&H, CBC, and BMP that you have a skid.
Yes, that's right. I'm on the way.
Okay, thank you.